Welcome to the Long COVID podcast with me, Jackie Baxter. I am really excited to bring you today's episode. Please do check out the links in the show notes where you can find the podcast website, social media and support group, as well as a link to buy me a coffee if you are able. You should not rely on any medical information contained in this podcast and related materials in making medical, health-related or other decisions. Please do consult a doctor or other health professional. I love to hear from you. If you've got any suggestions or feedback or just want to say hey, then please do get in touch. I really hope you enjoy this episode, so here we go. Hello and welcome to this episode of the Long COVID podcast. I am delighted to welcome my guest tonight, Dr Mark Harper, who is a consultant anaesthetist at Brighton and Sussex University Hospitals and also a cold water enthusiast who's passionate about how it can help people's health. So a very warm welcome to the podcast.
Well, thank you for having me.
I'm delighted to have you here tonight and really excited to talk about cold water because this is something that I am super into as well. So to start with, would you mind just saying a little bit about yourself and what it is that you do?
Well, as you said, I'm a consultant anaesthetist, so I put people to sleep and more to the point, wake them up again. That's the easy bit is putting them to sleep. The hard bit is waking them up again. Now, I do that half the year I do it in Brighton, half the year I do it in Norway. On top of that, I do research, and my first sort of research career was stopping people getting cold. So if you get cold during an operation, that's bad for you, and you have more complications, basically. And so I spent many years trying to stop people from getting cold and wrote a PhD about that. But now I expose people to the cold. Very important to realise they shouldn't become hypothermic, but that's something we can cover later. And in that way, make them better. And in fact, ironically, it could reduce the complications from surgery as well by doing that.
Wow, that's fascinating, isn't it? That something so simple as cold can be both a good thing and a bad thing in all sorts of different kind of circumstances. It's, that's cool.
I think the key thing is, and this is something always to remember with the cold water swimming and everything, is exposure to cold. So exposure to cold being a stress is good, if you expose yourself to cold, but you don't want to do too much of it. And so it's like having a workout and you're just, really working hard. And so you're really challenged and that's good. But if you pull a muscle and that's the same as hypothermia, then that's bad for you.
It's the classic everything in moderation thing, I guess, isn't it?
Exactly.
So how did you get into the sort of cold water side of it?
So I was already researching perioperative hypothermia. So this is getting cold during surgery. When I started swimming in the sea, and I'm a pool swimmer, basically, but one summer the pool was shut. Well, the pool was shut for a couple of weeks. Couldn't do my normal training. So I was just complaining to an old friend of mine about this. And he said, I swim with the sea swimmers. And I didn't even realise the club had a group of sea swimmers, let alone they swam all year round. And of course, I was just as amazed as everyone else is when they find out people do this kind of thing. And so I started swimming in the sea myself. And at that point, what I found was, I still remember that first time I did that swim. It was just maybe kilometre and a half, nothing too stressful, like going for a stroll, really. And then walking up the beach and just feeling really good, much better than I thought I would feel. And then as I discovered more about the effects of getting cold, I sort of started discovering stuff about cold water exposure and cold water adaptation. And what I noticed was the stress response to surgery was the same as was being described as the stress response to cold water. But even better, the way you adapt to cold water reduces your stress response. And so we could apply that to patients and maybe reduce their complications. Because stress response, we kind of discussed this, you want a bit of a stress response, you want it in moderation, but you don't want too much of it. And so what you get with surgery, although you don't feel anything, your body is still reacting as if it's being attacked with a knife, which essentially it is. And so by reducing that stress response to a more moderate levels, you can reduce the number of complications, because it's that overreaction of the stress response which has a large impact on your post-operative recovery.
That's so interesting, isn't it? I mean, I've obviously been looking at this through the lens of long COVID and sort of chronic illness, fatigue conditions perspective. So that's amazing to hear about how it can actually help so much with other things as well.
The interesting thing is, I think they can all be related, because what you're seeing with all these chronic conditions, and we'll obviously come on to long COVID specifically in a minute, but they're all related to inflammation. They're all, again, you want a moderate amount of inflammation. It's good as our first line of defense against attack by pathogens, for injury, for healing after injury. But what you don't want is too much of it. And again, that's what you get with cold adaptation, is a reduction to moderate levels and useful physiological, what I call physiological levels of inflammation rather than pathological levels.
So maybe we should talk about the sort of benefits of cold water. I mean, you've just mentioned inflammation, and that is, one of those kind of buzzwords around long COVID, isn't it? We talk about inflammation being one of the potential underlying things.
The thing about COVID is, okay, it's spread by a respiratory route through the air, through the lungs. Some of the most dramatic effects, and some of the effects that kill people, are not just that, is the effects on the lungs. However, what it primarily is a disease of inflammation. And what you find when people have really bad COVID, I'm talking about the illness here rather than long COVID, is that they have basically an allergic reaction, an anaphylactic reaction to the bug. And that's why what you see is exactly what you see with an anaphylactic reaction, plus a few more bits thrown in. And so by reducing that reaction, huge reaction, then you can potentially reduce the risk of illness and whatever from COVID. I mean, we know that people who exercise had a lower risk, and that's something that reduces inflammation. We also know that if you exercise, if you're doing regular exercise, when you have the vaccination, that makes it more effective. So there's a lot of stuff going on there which is related to exercise and stressing the body, but in a moderate way. So, and with long COVID, I think long COVID is very complex. And I think, and especially when you look at the autonomic reaction, that sympathetic, parasympathetic, crazy, all over the place type of thing. It's not as simple as inflammation, but it is, like fibromyalgia, like all these conditions. What is being described is a condition of inflammation. And so if you can do something that reduces this crazy response and this excessive response, then that is likely to help. And we certainly found that with fibromyalgia, and I think we're beginning to see it with long COVID as well.
Yeah, and what I've kind of been realizing over time from my own experiences and from speaking to people as well is that all these things are so interconnected. So if we talk about inflammation and your autonomic nervous system and your immune system and all sorts of other things that aren't coming to mind right now, they're all so interconnected. So if you were to trigger off one thing, then you have this kind of chain reaction, don't you? So that could kind of work in reverse, couldn't it? If you think, right, well, I'm going to tackle inflammation, then you would hope that, the reverse of the chain reaction, where you'd get a kind of like opposite chain reaction, negative chain reaction. I don't even know what you would call that, where you'd get the like de-triggering of all these things.
Well, yeah, I mean, I always, you think about the body. I mean, there are a couple of things in that. One is this whole distinction. We didn't quite touch on it, but this whole distinction between mind and body is, Descartes has got a lot to answer for. There is just no separate thing. It's just what we're aware of is through the mind. The body is totally linked. Everything in the body is linked, and the mind is part of the body, and you just can't separate the two out. But also, every system in the body is kind of, I always think it was Dr. Doolittle's push me, pull you. It's all in a dynamic balance. And what you find is, as you pull one way, the other thing's pushing the other way. So what you're describing and what you see is, the sympathetic nervous system has just like gone crazy and the parasympathetic doesn't have a chance. Or I think what also happens is with long COVID, you get the sympathetic sort of the push me, that always pushes you, and that's pushing you to one extreme, but then it gets a bit knackered, and the pull you bit of the parasympathetic pulls you all the way the other side. So you're just going crazily from side to side with no sort of kind of respite in the middle. And that is, what we're talking about here. We need to look at we need to look at bigger things. A single molecule, a single drug is just never going to work for this. What has worked, and certainly in COVID, maybe not in long COVID, is steroids. They're a dirty drug. They have all kinds of effects, and they're anti-inflammatory. So this is, what we need to do is, look at this whole chain and see how we can break up the cycles, which are just, really a bad part of the cycle, really not useful at all.
Yeah, definitely. It's almost like the bigger picture is the one we need to be looking at, isn't it? Rather than diving too deep into anything specific.
Yeah.
Because if you can find kind of the bigger kind of underlying kind of thing, then that's going to help everything, isn't it? Rather than treating one specific symptom.
Yeah, and with something as complex as this, anaphylactic reaction is like a whole host of things. It might take just one trigger, but it sets off a whole chain reaction. As you were just talking about, and that chain reaction, you can't stop it with one thing. You can't sort of just block histamine. You can't just block that and the other. That is all being set off at the same time. And you have to sort of kind of bring it all back with a more global response. And so we're saying with inflammation and how the body's linked together, and this is a good example of it with the autonomic nervous system, how that's linked, because one of the things about cold water swimming, one of the things that works, so that will have an effect, is putting your face in cold water. That stimulates the parasympathetic nervous system, and that has a direct effect on your levels of inflammation in the body. So they're all linked.
And of course, a lot of people with long COVID are actually, so sort of debilitated with fatigue that actually the thought of being able to get to a local lake or pond or loch or whatever country you're in would actually be too much for them to start with, whereas getting their face into the cold water in their bathroom, for example, that might be a slightly gentler route in for someone that wasn't able to get out.
Yeah, without a doubt. I mean, it's really interesting. So I do this thing with schools where we take the kids and to teach them about the sympathetic and the parasympathetic nervous system. I get them to put their hands in a bucket of iced water, and that sets off the sympathetic nervous system. And I get them to put their faces in a bucket of cold water or iced water. And it's incredible. We don't actually, interesting, we don't see that much of effect from the hand experiment, but from the face, it's remarkable. You see, they put it in and you see a little delay, but then their pulse goes down and down, which is the parasympathetic nervous system kicking in.
Why the difference between the hands and the face? Like, why does one trigger one and one trigger the other?
Well, it's more that the sensory nerves that come from the face are different to the sensory nerves in most of the rest of the body. And what it does is it goes through a nerve called the trigeminal nerve, but that is linked to the parasympathetic nervous system. And the reason it's come about evolutionarily, I think, is because it's the diving reflex. So if you throw a baby into the water, it will hold its breath, and that is the diving reflex, which is mediated through the parasympathetic nervous system. And so it's kind of a survival mechanism that has evolved, and it's still there. Not as strong, but it's still there in adults.
I mean, we probably shouldn't be throwing babies into water, but it's good to know that if we did.
Absolutely, but we do. I mean, yeah, I used to do it with my kids, but in a controlled environment. I'm not saying sort of throw them over the side of a boat into the water, but when you're in the swimming pool, they just loved it. From about 3-4 months, we took ours to Little Dippers and did baby swimming classes, which was just fabulous. And and it worked every time. We got the pictures; they're just amazing pictures. Just like the Nirvana baby of the kids under the water, just looking perfectly happy.
That's fantastic, isn't it? Amazing. So we kind of talked through how it related more specifically to long COVID, didn't we?
I think but one thing, so I've talked specifically about the parasympathetic, but so that's a short-term effect, it's an immediate effect. I think it's worth pointing out that the sympathetic reaction is also important in this, because when you put your body into water, you get the sympathetic reaction. And so your heart rate goes up, your blood pressure goes up, all these things. But what happens is if you do it regularly over a few times, and the water doesn't have to be too cold, less than 20 degrees is fine. And you don't have to do it too often. You can do it over the course of a day if you warm up. You can adapt over the course of a day if you warm up in between. But you can do it once a week for 6 weeks, and that would work as well. And it doesn't have to be for very long either, just a few minutes. But when you go into cold water, it stimulates the sympathetic nervous system. Over those 6 times, over a few weeks, your reaction will grow less and less. So whereas first of all, you'll take a big gulp of breath in, you'll hyperventilate, that goes down. Your heart rate, your reaction of your heart rate, your blood pressure is attenuated, so it goes down. It doesn't go completely, but that also in turn means that your heart rate generally goes down, so your general resting heart rate will go down a little, and your resting blood pressure may go down a little as well. So you're having a long-term effect. So what that means is, that stress response is sort of brought down to more moderate levels. So you spend more time in the good green zone rather than hitting the bad pathological zone.
Yeah, that's interesting. I mean, I noticed when I started doing it, I wasn't in for very long to begin with, but over time I was able to go in for longer. But to start with, I would get into the water and I would get out of the water and I would go, oh my goodness, that was cold. But I would feel great for, quite a short period of time, but it would be like, wow, I feel like I've been plugged into a socket. I would have more energy, but it wouldn't last. After a couple hours or by the next day, I'd be back down to, I'm knackered again. And then, a couple of days later, I'd go back in the water. I'd be like, oh, great, got my energy back, but it would never last. And then over time, that has kind of adapted. So now actually, I always feel better when I get in the water, but my energy levels don't drop so much in between. And it's almost like my body has kind of, is that an adaptation?
It's probably smoothed off, hasn't it? It's you're not getting the highs. It's like when you eat a really sugary food, your insulin levels go up massively and then they go down, so you're feeling pretty bad about it. Whereas you start eating better foods, lower GI foods or whatever, you see a more moderate effect, and the swing isn't so far. And I think it's really important to point out that you don't have to be in the water very long at all to get the effect. You weren't in very long. Anyone with long COVID is going to really struggle to stay in a long time. And we're getting towards summer now, but 2-3 minutes is probably enough. It's just long enough to get your breath back. Because how you go in, after 20 years, I still get, a real shock from it. I don't like getting in. It still really hits me when I go into the water. But after a very short period, your breath comes back, you can lie back, you can start enjoying the scenery. When you've got in that far, you've done everything really. You could maybe get a bit more, but by that point, you've had the most significant effect. And of course, you don't want to stay in too long because you become hypothermic if you haven't got long COVID. But if you have got long COVID, of course, it's going to be exhausting. So it's important not to push it. This thing about pushing it and staying in longer and longer. Yeah, fine if your water temperature's good and you're enjoying it, but don't do it for the sake of your health, because that's probably a bad thing. Don't push through that pain barrier beyond that initial shock, because it's going to do you more harm than good. It's realizing little is all you really need. Just get your breath back.
We'll be right back. I'm interrupting myself for a second to tell you about long COVID breathing. The fabulous Vicky Jones and I have teamed up to bring you long COVID breathing. We are both passionate about sharing our expertise and experience of the breath and how incredibly helpful that can be with long COVID. We've worked together to develop a course that is specifically tailored to those with long COVID. It's a 6-week course with 12 sessions, all delivered online. The community feel and learning that we're all sharing is such a joy. To find out more information and to sign up for our courses, workshops, and other shorter sessions, please check out the link below, longcovidbreathing.com, or email longcovidbreathing@gmail.com to start your breathing journey with us. Yeah, I think that was something I realized, and I've heard other people talk about as well. They said, oh, I went in and I felt good, but then, it kind of knocked me afterwards. And I kind of realized that actually, if you're going to get cold, then it's going to cost you energy to warm yourself back up again.
Mm.
So, you want to get in and get the effects of the cold water and, get that kind of feeling of being plugged in, but without letting yourself getting so cold that you're going to knacker yourself and use all your energy to warm yourself back up again, because that's kind of a waste of time, isn't it then?
Yeah, and that's it. And yeah, it's kind of, yeah, you just don't need to do that, and you don't need it. That's the key thing to know is, if you want to get the benefits, you will get them from just going in for that brief period of time. You can't just go in and get straight out again. That you can't do, but just long enough that everything comes back into focus, then you've done enough.
Yeah, that's definitely useful. I mean, I think a lot of people are the same. I certainly am. I'm like, oh, I want to see how long I can stay in for, and you just kind of realize that's not helpful. I need to get out before I start feeling cold. Otherwise, it's just not really helpful.
Yeah, I always think that when you get out and you want to go back in, you feel you'd like to go back in, then you've done it right.
Yes, yeah, that's true.
Yeah, 'cause if you're in too short a time, you've just got the pain. And you say, "Oh, I don't want to go back in. That was horrible." But if you stay in just long enough, you're still warm. You want to go back in. If you stay in too long, you're starting to feel cold and uncomfortable, and you won't want to get back in. So it's the perfect sort of middle ground.
Yeah, finding that sweet spot.
Yeah.
Yeah. So, I mean, I've noticed myself, and I'm sure this is common across everybody with long COVID, is this wildly fluctuating symptoms. And one of the things that I have found quite annoying, I was gonna say they're all annoying, aren't they? Really, but this sort of temperature dysregulation. So where I'd be either too cold or too hot, usually too cold, and then when I went into the cold water, on some days I'd be like, oh, this is great. I could stay in here for ages. This feels like a bathtub. And then the next day I would go in and my body would be like shaking before I even got in. I just couldn't tolerate it for so long. And I think this is probably related to hormones as well. So women are probably going to get hit worse by that maybe. But what would be your advice there other than, don't stay in too long if you're already feeling cold?
I mean, it's a bit difficult. With long COVID, I think it's a bit difficult because you don't have normal body temperature regulation. But I think, one of the key things, one of the things, I do is, one of my 6 rules in my book is go in warm. Make sure you're warm when you go in. It's best to warm up. Again, it's going to be difficult if you've got long COVID, but the best way to warm up is through exercise. Generate heat from the inside out. I mean, if you do something like you go into a sauna, then your body is heated all the way through. So that's absolutely fine. But there's a kind of bit in the middle where the outside's a bit warm because you've been in front of a heater or something like that, and the middle bit's not so warm, and that sort of confuses the body a bit. So the point being that if you can go in warm, if you're in a cold day, maybe it's not the best thing. I don't know. This is not something I've experienced. I mean, when you got out, was it just horrible? Did it make your symptoms worse afterwards, or did it still had a positive or neutral effect? It was just hideous getting in.
I think by the time I had caught on to the cold water, I had kind of realized that I needed to listen to my body more. So I think on the days where I was feeling like, holy hell, what is this? This is cold. I would kind of know that that wouldn't be a day to push it. So I would get out much quicker. I would generally still go in if I got the chance, but I would definitely get out a lot quicker.
And then when you got out, it was still okay. It didn't sort of kind of wreck things and make things worse for you.
I think generally not. It would probably take me longer to warm up afterwards as well. And I guess I sort of knew that, it's always going to take you a bit of time to warm up afterwards. And, you're going to have that sort of shivery 5 minutes while you sort of drink your hot drink and throw on your 16 down jackets and things. So I guess maybe it's really listen to your body, which is what we get told all the time, isn't it?
Oh yeah, and yeah, that's key. Whether or not you got long COVID, when it comes to the cold water, you've got to listen to your body. Yeah, and there's this whole thing about 1 minute per degree, which anything that attaches a specific number is wrong because you've already mentioned it. We've got hormones. Some days you're cold, some days you're warm, some days you've cycled to a swimming spot, some days you've driven, sometimes you've had 4 hours sleep, some days you've had 12 hours sleep. All of these things have an effect on how well you're going to tolerate the cold. And so the only way to know is to listen to your body.
Yes, I think that's good advice across the board actually. Yeah. And I've noticed it as things have been getting better that actually I'm very much more sensitive to everything than I would have been before I got sick because I'm now aware of all these different kind of things that play into how you feel. So whereas before I'd be like, oh, I feel a bit colder today, but I swim this distance, so I'm going to swim this distance. And now I notice it straight away. I'm thinking, oh wow, my body is really needing this today, but not enjoying it very much. So maybe we're just going to do a little bit today. But that's something I've learned over the last couple of years of doing it wrong. Unfortunately, that's how we learn, isn't it? Mistakes.
Yeah, I've been through that as well. Now, it's funny. I just sort of go down and it's like, well, today it's definitely a short swim today, or today, I fancy a much longer one. And it's funny how it's become subconscious now with practice. And yes, I've been there, made all the mistakes as well.
So, yeah, what would probably be really useful would be to kind of talk through some sort of top tips for people. I mean, in Scotland, it's starting to warm up a little bit. The water's getting a little bit warmer. The daylight's a little bit longer, which is quite nice. The midges are starting to come out, which is not so nice. But it's starting to get into the sort of weather where people who have long COVID or whatever might be thinking, maybe I'll give it a try. Whereas maybe they wouldn't have done during the winter. So, what are the kind of starting out kind of tips?
Well, I think it's you kind of said it in a way is that it's getting warmer. So start when it's warm. I started in the middle of August, and that's what I just carried on. I had no intention of carrying on. 20 years and a book later, and a sort of second research career. Here I am talking to you. But it was. I'm sure it was because I started when it was at its warmest. So it's probably about 18ish, 20ish at the time, and still had that effect. So that's one thing. So now's we're getting there. I meit's still May, still quite cold. Take a little while. June, July, possibly better. But in the meantime, you can work up to it. There's we know cold showers. So the two things that affect the effect of the cold, if you see what I mean. One is the absolute temperature of the water, and the second is how quickly you become cold. So with a shower, in a normal house, you're probably getting water that's coming out about 18 degrees or whatever. So it's not as cold as Loch Ness, for example. So it's not quite as cold, but it's still cold. And the other thing is you don't get quite as cold quite as quickly as you do when you put your whole body in water at once. So there are things you can begin with, which is try a cold shower. And this is the interesting thing, that there was one study which showed they took an office and divided half the workers into a group which had cold showers and half who didn't have a cold shower in the morning. And the cold shower group took less sick days off. So, we've seen a measurable effect. It's not as much as immersion, but you have an effect. So that's one way of starting. And then, you take it up next level is get into the bath, get into a cold bath. Again, that's going to be 16, 18 degrees centigrade, something like that. And that will have more effect than the shower, but it will start adapting you to it. Then there's also the face thing. We've discussed that already, putting your face into a bowl of cold water or iced water or whatever. I think an important thing, though, is especially with the autonomic effects of long COVID, is that you just do one first and then the other. If you just do the face in the water, that's fine. But if you're going to do the bath, then get your body into the bath first and get used to it, get past that initial shock, and then only then take on the parasympathetic nervous system and put your face in the water.
And with the bath, we're still talking just a couple of minutes is enough, is it?
Yeah, again, just long enough to be until you recombobulate. 18, 20 degrees, you can stay in longer and it's totally safe. But, why bother? Why put your body under that extra stress? And I think what's happening is you're beginning to break some kind of cycle that's going on, that this kind of vicious cycle that's going on in the body. And this is what we're trying to do. And it's certainly, I think this is why it works, I think, for mental health as well is there is this inflammatory effect, but there are bits you can't explain just through inflammation. And I think what's happening is it's interrupting negative thought patterns as well. I mean, so a bit of a tangent, but the reason I think this is that I saw there's a great TED talk by a woman called Jill Bolt Taylor called My Stroke of Insight. Now, she's a neuroscientist in the US who had a stroke one day. And she woke up and said, "Oh, I'm having a stroke." She knew about strokes. She was a neuroscientist, but she didn't care. She said, "Oh, this is quite nice, actually." And the reason she thought it was quite nice is because what was happening is she's having a bleed into the left-hand side of the brain. So it's suppressing the left-hand side of the brain. And that is the part of us which does time, does worrying, does, keeps us safe, logical reasoning thinking. And that was being suppressed by the bleed. Whereas on the right side of the brain, that's being in the moment, that's empathy, that's being at one with nature. It's just that all the happy parts, as it were. And she recovered 6 years later. She recovered, and the thing that motivated her was to get everyone to take a step to the right, as she calls it, is because she saw how amazing this was. We're stuck in the left side of our brain, which is constantly anxious, constantly trying. That's our to-do list. What we need to do is step into the right side of the brain. And certainly, I'm lucky enough not to have suffered from mental health issues or anything. But when I get into the water, I get in on brain going everywhere. I can often cycle down. I can be hot and sweaty, and and then I get out, I'm utterly transformed. I am in the right hand side of my brain. I am thinking, yeah, isn't this nice? This is lovely. And so, I think, it's just taking you out of the left hand side of the brain, taking it away, breaking that cycle and sending you to a different place. And I think maybe this is what we're seeing, some similar effect on the autonomic nervous system. I don't know, on inflammation, but just breaking these cycles in some way.
Yeah, I mean, I think mental health and the mental health side of long COVID is something that is quite difficult to talk about some of the time, because I think many people with long COVID have struggled with their doctors, with their health professionals, because they've been gaslit either by the doctors or by their family and friends or by, whoever. And a lot of people have been told, oh, it's just anxiety. So people who have genuine mental health concerns alongside their long COVID, because why wouldn't you when you're, long-term ill? I think a lot of people are quite worried about saying to their doctor, I have anxiety, because they're, worried that their doctor is going to turn around and say, oh, well, yeah, that's what I've been telling you for ages. And, sort of all the gaslighting and stuff. And this is something that I get really annoyed about, because mental health is incredibly important, and I have had a huge amount of anxiety. It's not the cause of my long COVID, but it's caused by long COVID, but it then feeds back in and makes the other physical side of it much worse, so you end up with this cycle. So I think, something like cold swimming that can really help the mental health side of it as well. I think that is a really, really important side of it and shouldn't kind of be overlooked.
As I sort of said earlier, you can't take the one from the other. You can't take the mental health from the physical health, because your physical health affects your mental health. And we know, 60% of depression is related to inflammation. And this is how I came to think that maybe we could use cold water swimming to treat depression, was because first it was like I felt really good when I had a swim, but then I read an article in the newspaper saying, well, actually, maybe depression is some sort of an allergic reaction, because so much of it is related to inflammation, and you can fix the inflammation type of depression. And again, it's really difficult because depression is many, many things. Long COVID is many, many things. Fibromyalgia, it's a very complex process. But taking it from a very simple lesson. The 66% of whatever it is, depression that is related to high levels of inflammation responds to different treatments, including anti-inflammatories, to that type of depression, which is not inflammation related. So you just can't take them. You can treat the inflammation, say through cold water swimming, and both will get better. You just can't take them apart. It's you're going to feel anxious with it because you've got these high levels of inflammation. You've got this crazy autonomic nervous system. Your microbiome is probably all screwed up as well, and you got to treat all of these things. And that's why I think something like cold water swimming is such a good thing. Good thing to try. It won't work for everybody, but it's this global thing that works. It works over the whole body and the mind, and in a kind of integrated way. And that's why I think it's worth giving it a go.
Yeah, definitely. I mean, it's fascinating what you were saying about the person with the stroke. And I have a very, very busy mind. I'm one of these people where my brain refuses to switch off and it's like a hamster wheel. And I think it drives anyone I'm speaking to completely crazy. And I've definitely noticed that being a little bit of a theme across people that I've seen with long COVID. But when you get into the water, it calms down, it shuts up, it goes away. And I was swimming the other night. It was beautiful, sunny, calm loch. And my friend said to me, that look on your face, you have never looked so happy. And I must have just been like floating in the water with this massive smile on my face. And all of the other things in my life that are stressful, that I'm worried about, that I'm thinking about, or the plans that I have, or, whatever it is, none of them were there at all. I was just like floating. And it's amazing, isn't it, how it can do something like that.
Yeah, it is. And this is exactly what Jill Bolt Taylor described. You just took a step to the right and you're out of that busy to-do list on the left-hand side of the brain.
We can't live all our life like that. We probably need the other side of our brain sometimes, but
Definitely, yeah.
but yeah, we do. We need to get out of there some of the time at least, I think. And that's something that I find very, very difficult.
Yeah, and there are other ways. There are many other ways to do it. It's yoga, breathing. I just do a short breathing thing. 6 minutes of 6 seconds in, 6 seconds out. I mean, it's so simple. It's just a little app on the phone, and it just transforms me from frazzled to not frazzled and a bit more awake and stuff like that. So it's not just down to the swimming, but I definitely have a real hit when I go swimming.
Right, we've made a massive tangent because we were talking about tips for getting in the water.
Well, I mean, I've got a few rules about getting into the water. So, one is, get your body in first and then afterwards, and then go in warm. Make sure you know where you're going in is another one. There's this thing called Agnes Allen's rule, which is almost anything is easier to get into than out of. It applies over everything in life. I mean, I think it's utterly brilliant. Anyway, but that's the same for cold water. Make sure you know how you're going to get out before you get in. And then warmth is important when you get out. All that water on your skin, you won't feel it, but the water on your skin will cool you down very rapidly if you don't get dry quickly. So get out, get dry, get warm. Get out of the wind as soon as you can. And then do it with someone else. It's much safer. And there's so many people. And then we discovered like Chill, which is the group that we've been running our clinical trials through. Started in Devon. They run courses. So Mental Health Swims is kind of like a meetup group. There's also like the Blue Tit, which is another meetup group. And then you got something like Chill, which is more kind of giving confidence in the water. About confidence and fun and everything, but just gives you that introduction to the water so you can get used to it. And there's a couple of groups in Scotland already, but we started in North Devon, and that's expanding all the time. Very keen to sort of support people to go out there, and that's about just getting into the water, getting used to it, getting the head under the water, not being scared of that. And then so with the view that you take it further, and this is what we found, is that people will come on the course and then they'll, which is 8 weeks or 8 swims, sometimes do it over 4 weeks. And then they'll go on and over 60% continue to do it in some form afterwards.
We'll be right back. Hey there, I'm just jumping in for a second to see if you're enjoying this episode. If you're finding it useful, maybe you would consider sharing it somewhere, a friend, a group, or even on your Twitter feed. If everyone was able to share just once, we'd be able to get this information out to even more people who really, really need it. So please consider sharing somewhere if you possibly can. I hope you enjoy the episode, and thank you so much. Yeah, that's amazing, isn't it? 60%. I mean, you were talking about groups just then, and I joined a group quite quickly. I started sort of going in, my other half came with me. But he couldn't come all the time. I wanted to go in more often than he did. He did it because I did, rather than because he particularly wanted to. But joining a group, I mean, one of the things I've noticed with long COVID is how isolating it is. A lot of people aren't able to work. You're not able to socialize in the way that you were before. A lot of the hobbies that you did, you can't do anymore. Therefore, you're not seeing your friends through those things. Even a lot of people aren't able to sort of see people at all. Engaging online even is exhausting, sometimes more exhausting than doing it in person. But when I joined this swimming group, they didn't know the me from before, so they weren't comparing the me from before, and they weren't judging me on anything. If there were days where I didn't want to swim very far, or I just wanted to sit in the water, then that was fine. But you get that social aspect that so much of us have lost. I think we maybe forget how important that is sometimes.
Yeah.
Because you're so sort of stuck on your physical symptoms and, oh, this isn't working, or, this isn't working. My nervous system's haywire. I've got inflammation here, and I've got, whatever it is that people are suffering with. So yeah, I think the sort of social aspect of it has been quite a big thing for me, and I didn't expect that.
Yeah, and we know that social connection is one of the most important, one of the most significant determinants of health in any form. Quite apart from long COVID, social isolation is totally independent and powerful indicator, or cause, in the loosest possible sense of the word, of ill health. So that's absolutely, and this is one of the reasons why I think outdoor swimming is so good, is because it's this whole package of benefits. Again, as I said, it's a global thing anyway. That cold water gives you a kind of global effect. But also, you've got blue therapy, being out with water. We've got green therapy, being out in nature. We've got social things. You've got autonomy. You're self-determining your treatment, and you've got exercise. All these things we know independently to be good for health. So that's why it works, and it's like neatly packaged up into something that was quite fun to do.
Yeah, and you can do it at your own level, I think, as well, is just such a big thing, isn't it? I think exercise can be a bit of a contentious subject when we talk about long COVID, because exercise, people see that as like, pushing yourself, going for a run, something big, and a lot of people aren't able to do that, or if they do make themselves do it, then it puts them in bed for a week or something. But doing some sort of exercise or movement that works for them. And I don't know, I'd be curious as to your thoughts about post-exertional symptoms as well, because if you go for a walk and it's a bit further than you should go, often it'll knock you out, and you'll get post-exertional malaise or post-exertional symptom exacerbation. But I have never got that from cold water. I've got it from all sorts of other things, like brushing my teeth sometimes, but I've never had it from the cold water. And is that just because I've never pushed myself too far, or is that because of the cold?
I honestly don't know. I can offer some theories. One is, it's because of the cold, but I think also a really interesting one is because it supports you. The water supports you, and because it compresses around you as well. Maybe, I don't know. Does this have some effect on the way the vessels, the sympathetic nervous system, all this expansion and contraction of blood vessels? Maybe it's because it has some effect on that. But I think it's something to do with the way you're supported. But I don't know quite what it is. But this is it. I did a thing at the Scottish Parliament a few weeks ago, for the Save Our Pools campaign for Scottish swimming. And one of the points I tried to bring out there is, how swimming as an exercise is something that for a lot of people with illness, it's kind of the only thing they can do because they are supported while they're doing the exercise. And, you can go, your Zimmer frame and do walking or with your walking sticks. But there's always the risk of fall. It's always very tense. Whereas you get into the water, there's no tension there at all. You can just let go. You were just describing a minute ago how you were just lying back. And we all do that. That's one of the joys of being in the water. And you can just let go.
Yeah, it is. It's much lower impact, isn't it? So I guess for people that are unable to do quote unquote exercise, but want to try something and want to get outside, maybe getting into the water and even just kind of sitting in the water for a couple of minutes, that might be a good way to start, maybe.
Yeah, and we know that any increase in exercise has a measurable effect. You can do lots. The more you do, the better, basically. But any increase in exercise has a measurable effect on cardiovascular health. So even just getting out of the car, walking down the beach or down the path to your swimming spot, getting in the water, getting out of the water, walking back again, that will have a measurable positive impact on your health. So as you said, we think about exercise as a 10K run or something like that. We don't need to. We can just think of it as any physical activity. And yes, the more we can do, the better. But obviously with long COVID, that's very difficult to do a lot of exercise.
Yes, exactly. Yeah, the more you can do, the better, but within the kind of parameters that is not going to trigger issues, I guess, isn't it?
Yes, exactly. I mean, I suppose the other thing I'd say is, so I've wrote those 6 rules, and then after the book was published, obviously I've talked about it quite a lot, and I've brought it down to even more to like the next one was 2 things, which was minimize discomfort, maximize fun. And by that, I mean, minimize discomfort, wear shoes, wear gloves. That's going to have no effect. It's the effect on the body. And, putting your face in is great. But wear a swimming hat. Because it is just the face, not the whole head. It's just the face, and put the whole head in. That can be uncomfortable. I don't want that. So use all those little extra bits. A wetsuit, I know it's such a pain, but you can use a rash vest or something like that. You wouldn't want getting in and out of a wetsuit makes it. It will have an effect, but it makes it more effort than it's probably worth for what we're talking about here. So think carefully about that.
Yeah, I definitely found that the wetsuit was more trouble than it was worth. I would rather get changed quickly and stay in for less time.
I find this really interesting. I think with long COVID, it's something I've been a bit worried about. I feel it should work, but because of all these sort of really difficult symptoms, particularly the autonomic ones, I've been a bit concerned that maybe for this it wouldn't quite do the job. But your experience and more and more feedback we're getting is that it is a good thing. So if anyone who does take it up has any comments about it, please get in contact and just let me know what your experience with it is, because I'm really interested to know if I want to know if it has a bad effect or it has a good effect, because this is how we can take it forward and work out ways of introducing it to people, because it is potentially, as you found and others have found, of great benefit.
Cool. Well, thank you so much for joining me tonight. It's been so fun chatting to a cold water enthusiast, but also really helpful as well. And hopefully you've inspired loads of people to maybe at least think about giving it a try. So thank you.
Yeah, a pleasure. And thank you for sharing your experiences as well.
Thank you so much to all of my guests and to you for listening. I hope you've enjoyed it, or at least found it useful. The Long COVID podcast is entirely self-produced and self-funded. I'm doing all of this myself. If you're able to, please go to buymeacoffee.com/longcovidpod to help me cover the costs of hosting the podcast. Please look out for the next episode of the Long COVID podcast. It's available on all the usual podcast hosting things. And do get in touch. I'd love to hear from you.